Doctors of Reddit, what is the most oh frick how did this happen thing you've seen? I think working in medicine is just a series of WTF moments, the current top always getting out crazied. My current is when I was covering in the trauma bay and we get a page along the lines of a dog bite amputation. We think, okay, the EMS guys are being over dramatic. Nope, patient legit had a limb removed from a bite. Best I could say is that at least the dog must have been massive because it wasn't torn apart, but more of a clamp down once and right through. What generally gets me is how easygoing so many people are about amputations in general. You'd think even if a person knows they are probably losing a leg or arm they will still be emotional or scared about it. Nope, so many are just like, okay, when is the operation and how long do I have to stay here until I can go home? I wonder if their nonchalant reactions have anything to do with the leaps and bounds, pun not intended, we've made in prosthetics recently. Optometrist here. Had a patient who overwore her soft contact lenses for over 7 months straight without removing them. The contact lenses deprived the cornea of oxygen and tiny blood vessels started to grow from her eye into the contact lens. By the time I saw her, the contact lenses had been fused onto the front surface of her eyes. Her eyes were bloodshot and she was in a great deal of pain. The contact lenses could not be removed. Our corneal specialist had to bring her into the operating room and sever all of the blood vessels to peel off each of the contact lenses. Physician anesthesiologist here. A nice young lady was sitting in her car when someone came up and put 3 bullets into her through the driver's side window. One missed her and one hit her in the right lung, causing her lung to collapse. Nothing crazy yet. The third one entered under her left armpit and there was no exit wound. Turns out the bullet settled into the tiny space between the heart and some of the biggest blood vessels in the body. A centimeter in any direction almost definitely would have killed her. The bullet was in such a dangerous place that the surgeons ultimately decided to leave it in. I've posted this before, but it's kinda lighthearted. Running EMS. We had a 22-year-old kid going in for a doctor. Apt picked him up from a nursing home. He was there because he was a former gangbanger and been shot 5 times in the abdomen and pelvis. Pelvis almost completely destroyed and removed. During transport, he asked me if I wanted to see a trick. I said sure. He pulled his pants down slightly, exposing his upper left leg, was deformed from surgery, and had an open wound, although small. This guy twitched, and his femur shot like 6 inches out of his body, like Wolverine's power, if useless and gross. He twitched again, and with a slurp it retracted. I told him that can't be a good idea to do, but he told me he's only 22 and won't walk again, so why not have fun where he can? Not a doctor but an RN. We had a lady come into the ER because she couldn't get her shoe off. The triage nurse looked at her shoe and found a nail straight through the bottom of her shoe and into her foot. The patient had undiagnosed diabetes and her feet were numb from neuropathy. A good friend of my family is a doctor. His favorite story is the one of this guy who came in with the branch of some coniferous tree in his urethra that he couldn't get out anymore. They had to cut his dong open, as there was no other way to remove that thing. The man said he was at home, decorating the house for Christmas, slipped, and fell on the table decoration. Sure. Hand surgeon here. Had to operate on a guy whose hand went through an industrial ruler. Every single bone in his hand down to the distal radius and ulna was completely shattered. Ended with multiple phalangeal amputation and a moderately deformed hand. Only moderately, though. Think I've posted this on a similar thread before, but here goes anyway. I'm not a doctor. My dad isn't a doctor and my mom isn't a nurse. Like someone else mentioned, stuff in people's asses is way more common than you think. Anyway, one night my dad is working and some older, probably mid-50s gentleman, comes waddling into the ER on his own, fills out the forms, sits down, sort of etc. Didn't seem to be in pain so my dad and the other people working weren't in a hurry to get to him. Once they do my dad sees him off in a side room and asks him what's wrong. Well doc, I've got a cantaloupe stuck in my butt. Sorry, did you say a cantaloupe? The guy pauses, looks at my dad right in the eyes, and to his credit is 100% honest. Yay doc, I'm a pervert. A freaking cantaloupe. I love the sheer shameless, honest declaration. I'm a pervert. Now please remove this cantaloupe. It's a pain in the butt. I'm a medical editor, not a doctor. The one case that sticks with me is from a surgical journal. It was of an elderly woman who tore out her own eyes, owing to her previously undiagnosed mental condition. Self-inflicted related to psychosis is apparently a real thing. The doctors who sent in this article were the ones who attempted to surgically reattach her eyeballs. I will never forget that they included a picture of the eyeballs, prior to reattachment, lying in a petri dish, with the optic nerve still attached. 20 years later, I still can clearly visualize those eyeballs. $20 to whoever finds the picture. Years ago, while working in the OR, assisting on a laparoscopy when the surgeon decided to have the nurse clean the woman's belly button. Turned out her belly button was much deeper than normal and appeared to have never been cleaned. It took the nurses at least 15 minutes to finally extract a concretion, many years worth of dirt, dead skin, etc. that had been there so long it had hardened like a rock about the size of a pecan. I've seen lots of horrific things, but this one has stuck with me more than 30 years later. I misread that as pelican and got really horrified. Full disclosure, EMS, not doc. I recently had a PT that had an operation on the lower back. It was a rather easy procedure, and it should have been a pretty routine healing process, changing dressings every day. Except this person was in the care of a nursing home, and bad things happened. The nursing staff allowed the back wound, plus 2 other wounds, become infected and necrotic. My partner and I were livid, and the nurses couldn't figure out why. It made us so angry to find out that they only changed the dressings once a week. Here's the kicker though, we didn't know about all 3 wounds, just one on his back, and another on his ankle. We didn't find out about the third until we brought the man to the doctor's orders upon revelation of the wounds. We had transferred care, and I was cleaning the stretcher. My partner was out talking to the hospital nurses. I'm just scrubbing away when I glance back into my PT's room, and I see him leaning over the side of the railing and not moving. I panic for a second, like holy crap, this guy just killed over. I ran back in and asked him what he's doing. Oh, I'm just trying to get comfy. My rash is burning. Rash? This is the first we had heard of it. So I investigate. I swear to God, the smell was worse than a GI bleed. This wasn't a rash. It was a hole in this man's hip, literally the size of a softball. I guarantee I could fit both my fists in, and it was necrotic and stuffed with week old gauze. It's so sad that nobody took decent care of the man until he was admitted to the hospital. My wife is a medical assistant at a cancer center. She specifically works for the breast cancer department. She told me one day after coming home and popping a bottle of wine that she saw a patient that had neglected care so much that her breast had gone necrotic. As my wife was helping with the dressing, she watched in horror as an entire tumor slipped out of the poor lady's breast. Just popped right out. Lab tech here. I went to collect samples from a patient with complaints about stomach pain and bloating. When I showed up, he was vomiting up bile. The lab results later confirmed that the bile was feces. Apparently he had been constipated for 2 weeks and was so backed up that his poop went from his digestive tract to his stomach and out of his mouth. Not me, but a doctor I know told me of a man with cancer in his face from tobacco whose entire lower jaw had rotted off, and the only thing keeping his face clean of rotting flesh were the maggots eating his face, and he'd have to lean his head all the way back and pour water over his face to drink, inevitably swallowing a few critters in the process. That one's hard to forget. This seems to fall under the just kill me category. The main thing I'll learn from threads like these is to never ever put anything up my butt without tying a rope or something to it first. Flared base. Your rectum is like a vacuum. Don't put anything up there that doesn't have a flared or suction cup base. My dad isn't a doctor, and people coming in with stuff stuck up their butt is pretty common. Usually it's something like a pen or a potato, but one time someone had a light bulb. They always have a story like I was taking a shower and sat on a potato. I did hear one about an old man that came into the OR with a broom handle in his butt. They asked him what happened, expecting the usual sweeping naked story. He said, well, I was riding this broom and masturbating. When I came, my knees gave out. Had a guy come in because my leg hurts. Apparently he had a dog bite 1 year ago, only had it checked out once after it happened and got antibiotics, but never came back when it didn't improve. got him in the room and was confronted with 2 pairs of jockey underwear soaked through with pus from a gaping infection down to the muscle that covered most of his calf. Said the underwear was the only thing he had to use for a bandage. Said he finally came in cause he started worrying he was gonna lose the leg. I'm a med student and orcs nurse. When I used to work on a vascular ward, the consultant removed a patient's foot dressing, their own from home, and their little toe came off with it. The consultant just had to snip a tendon and it was free. The patient didn't feel a thing. Diabetes is bad. We do diabetic toe amputations with minimal to no local anesthesia all the time. Diabetes will really frick you up. Obligatory, not me but someone I know. When my sister was training to be a nurse in pediatrics, late 1990s I believe, she was training at one of the biggest children's hospitals in the country. Girl aged around 14-15 came in with severe lower abdominal pain, refused to give the doctors any information until her mother was out of the room. My sister and the doctors were then informed by this girl that her boyfriend had fricked her with a hairbrush and the object had become lodged inside her for a couple days. The girl had to have emergency surgery to remove it. Not a doctor, but about 20 years ago, in a small hospital in France next to where I lived, a lab technician started complaining about pain in his left leg. Turns out that after changing the radioactive source from the X-rays machine, he had a brain fart and kept the spent one in his trousers pocket for the whole day. They had to amputate him, if I recall. EMT and former scribe. I used to work nights in Vegas in the year and would see all kinds of weirdness. One day I'm working in the trauma area and a nurse practitioner from the Tridge area walks up in a huff. She's a friend of mine, so I ask her what's up. She tells me very exasperatedly that she needs to ask the doctor a question. Long story short, a man, about 26 if memory serves, she was seeing had decided to masturbate using his class ring, which was easy to put on and not to pull off. He then asked his parents to help him. When they had no avail, they decided to go to the ER. At this point I'm laughing so hard that I'm crying because, like who wouldn't, she then tells me that because it's a class ring, it's too thick for the ring cutter and actually broke the blade. So I walk out and see a nurse and a scribe trying to reassemble this broken ring cutter and try so hard to contain my laughter as the family is in a nearby room. Eventually they got a blade from another floor and cut the dang thing off. But not before the mother filed a complaint and chastised the NP for laughing at her son, to which the NP replies something to the effect of, "What would you do if this situation happened at your job? Great night. TL. DR. 26-year-old used a class ring to masturbate and got it stuck around his wang." Not a doctor but a nurse. During a clinical rotation in school, my instructor pulled us into a room to explain the importance of full body assessment. Patient was a mid-60s male, homeless, tended to use the ER when either withdrawals hit or needed warmth. Because the ER does a focused assessment, the man had been coming in for months without receiving a full body assessment. My instructor asked to examine his feet. When she pulled his socks off, his feet were rotting. Not as much "oh frick how did this happen," but more of a "oh frick this is how that happens." That was also the day I learned how to poker face and give a "don't worry, we've seen it all," even when I hadn't. Nice gentleman. I had serious back pain and a searing pain at the start of my butt crack. Turns out I had a pilonidal cyst on the small of my back caused by an ingrowing hair wrapped around my spine that was like a meter long. Worst month or so of severe pain in my entire life. The operation had to be left as an open wound and had to get old gauze taken out, cleaned up and repacked with gauze every single day for like a month and a half. Had that surgery done in February, was in pain before that for months. Glad I got the procedure done. Now all I have to deal with is my scars look like train tracks and my butt crack is 4 inches shorter, lol. Obligatory, not a doctor but my friend worked in a factory making bits for aviation. He was cleaning the oil from one of the machines using an old rag when he accidentally dropped it in. Without thinking, he grabbed the rag which wrapped around his thumb and tore half of his hand off. He managed to actually stop the machine and walk to the manager's office before going into shock. They managed to salvage his thumb and using skin grafts from his leg and several operations, he now has a Frankenstein hand. I had a substitute teacher in high school that lost his thumbs in a shop accident, so he had his big toes attached to his hands. Not a doc, but my best friend is an orthopedic surgeon. Back in residency on a trauma rotation, he got called because a motorcyclist needed a consult on his legs. The motorcyclist's legs arrived in a garbage bag and in a separate ambulance. They were pinched off his body and the crash at his pelvis, so that was wrecked too. Medical student here. The classic story from my hospital was a guy who came to the clinic. Whole room stank the minute he walked in wearing these boots. Everyone knew that it was a bad case of diabetic foot, but no one realized how bad. Anyway, a job needed to be done, so the doctor running the clinic proceeds to take the boot off to inspect the leg better. The boot was difficult to remove. Doctor struggled with it for a while. Finally the boot came off, along with the foot. Turns out the guy had been avoiding taking off his boots for a couple months because his feet stank so badly. So the tissue died in there, got infected, wet gangrene, and stuck. Then it pretty much auto-amputated. Same thing here. I'm hospital security. A guy came in smelling to high heck with diabetic's feet, still wearing the yellow hospital socks he was given on a visit ages ago. A large portion of the foot degloved and fell apart in the initial exam. Both were later amputated below the knee. One of the worst smells ever. Not a doc, but a CT tech. Had a requisition come over for a facial CT that said facial erosion. Went over to get the patient and half of his face was missing, as in a giant, pus-filled open sore. He had an aggressive skin cancer that he never treated for 16 years that ate it away. When I went in the room to get him, he turned his head to look at me and I will never forget the sight and sound of the pus sloshing out of his face onto the floor. It's the only time in 12 years of healthcare that a patient has made me vomit. How can people let themselves go like this? Or how can other people just see this and let it happen? This made me so sick. I worked at an urgent care while in nursing school as a medical assistant, and a lady came in complaining of breast pain and drainage. When she took off her shirt, she revealed what appeared to be stage 4 breast cancer. All sorts of deformed growths covered both breasts. She said it had been that way for some time. Not sure why that day was the day she decided to be seen, let alone at an urgent care of all places, but there we were. I immediately went and got the doctor, who in turn immediately referred her to a proper oncologist. I'm not sure if he told her how bad it was or could be. He was a hematologist oncologist, so he had some cursory knowledge of breast cancer. He wouldn't really say. Unfortunate aspect of urgent care work is you hardly ever get follow-up information when serious stuff does come through. Some people are born with all their internal organs reversed. I've seen a few. It amazes me that this happens and people can go their whole lives not knowing. How does this happen and how someone with this mutation come out perfectly able to live totally normal lives? This one's pretty crazy to me. Not a doctor, just look at scans for a living. This is just a fun condition people can have, you can Google it. I work at an urgent care and a doctor had to do an x-ray on a little kid because he was short of breath. Didn't have pneumonia, but found out organs were reversed. Crazy. I work for an ophthalmologist. We had a 16-year-old kid high on M think there was a government tracking chip behind his eye, so he decided to cut out his eye with razor blades. He only manages to lacerate his eyelids. Once he came down he freaked out, went to the ER, they cleaned him up and referred him to our office. This kid leaves ammo from the ER, gets high again and just started jabbing his eye out with his finger. He stays high for 3 days, comes down and then goes back to the ER. This time the ER send him directly into our office. He comes into our office, he has it covered with a Dixie cup and tape. He said he kept it covered like that for the last 3 days. Before I even got him into my office I could smell the infection. I took off the Dixie cup and I thought it was covered in Vaseline. It was covered with infection and his vitreous back part of the eye, it's like a jelly substance, was mixed in with it. It was so bad we instantly cancelled the day and had to take him to the OR to remove his eye completely and start him on IV antibiotics before he had brain damage from the infection. This was 16 years old kid. After all this he still did M for years. I saw him around 3 years after this and he was finally clean out on a lot of healthy weight and said he goes to schools now and talks about the dangers of M abuse. I'm glad he's finally better. I had a case of a guy newly diagnosed with lung cancer. A code blue is called, meaning his heart stopped or he wasn't breathing. I arrive on the floor and it smells faintly like a skunk. All the nurses are crowded outside a room that has a door close, which is unusual. Usually in a code, everyone is crowded into a small room working on the patient. Story goes, the phlebotomist went in for some blood draw and found the patient had shot himself in the head. Blood brains all over the floor. He calmly approached the nurse's station and told them, code called. His son had apparently arrived earlier with a duffel bag and then left. Carrying a firearm on hospital property is a felony. The son was investigated, but not sure if charged. This is now a crime scene, so cops were called. Unfortunately, telecalls and patient Ms. Heart is still beating. We then had to perform what all of us knew was futile CPR with blood spurting out the bullet hole in his head with each compression. Obligatory, not a doctor. However, my friend is an emergency room doctor. She once had a guy come in with a dislocated elbow. From fist pumping to hard. This is practically wholesome compared to the rest of this freaking horror crap show. Obligatory, not a doctor, but I've worked in healthcare for a while before deciding it wasn't for me. One day a car drove up to the door and the driver came into the holding his face with both hands but didn't seem to be in much pain. When asked questions he just mumbled and couldn't get the words out very well. Then he took one hand off his face and makes his hand into the shape of a gun pointed at his face. Blood starts dripping from his mouth and they immediately admit him to the emergency room. Apparently the guy tried to commit suicide and the bullet just bounced around inside his skull and left the inside of his mouth mangled. The doctors told him that he would need to be immediately taken to the OR. The patient then mumbles to ask if he could step outside to have a cigarette before he goes in. To this day I still wonder how he planned to smoke with his mouth being in the condition it was. Not a doctor, but I unknowingly had scoliosis and I'm not one to really complain about anything. I just thought I was lucky and looked ugly as heck. Turned out my spine was a freaking train track. Pathologist here, so I mostly see the parts after they have been removed in surgery. Worst specimens I've received. 1. Hemipelvectomy, entire leg and half of pelvis, removed for sarcoma. 2. Total pinectomy for squamous cancer that had been left for so long that it had maggots growing in it. 3. Scrotal melanoma. I don't know what half those words mean, and I think I like it just fine like that. Okay, maybe a urban myth, but someone once told me a story about a guy who was smoking weeds with his mates who read that you can't put a light bulb in your mouth without getting it out again, as when your jaw gets over the widest part it'll lock shut. Obviously he then tried this. Once the bulb got so far in his jaw locked around the light bulb and he couldn't get it out. His friends called a taxi to take him to the hospital and him and a friend went along to A&E. The taxi driver was intrigued and wanted to know how it happened and laughed as the guy's friend told him what happened. Sat waiting in the hospital waiting to be seen, and a few hours later in walks the taxi driver with a light bulb stuck in his mouth. It takes every ounce of willpower I have not to try it whenever I see this fact pop up. Not a doctor and not a super messed up situation, but you reminded me of one of my favorite interactions. My dad had a chronic illness that required him to take a cocktail of medications each day, so as with most people in similar situations he started prepping them in advance to eliminate the tedium. One day he was particularly engaged with a show and reached for his medicine without looking and downed it immediately. Suddenly he realized it didn't seem quite right and looked down to see that he had swallowed an entire bottle of Tylenol pills. A trip to the hospital and a pumped stomach later the doctor asked my dad what had happened, obvious presumption being a suicide attempt. My dad explained what had happened and the doctor just stood there for a moment, shook his head and said, "That's too stupid not to be true." Not a doctor, but this happened to me. I have a genetic nail disorder that before surgery, would get extremely severe and I would need heavy antibiotics. I ended up getting a yeast infection, which wasn't uncommon for me at all since I've done through this process probably 5 times at this point. However, my regular doctor was at one of those 3-4 week convenient kind of thing and I was given another doctor in the office. This medication freaking destroyed my insides. I remember waking up at 3 AM in so much pain I couldn't speak and ended up going in and out of consciousness from said pain. I had horrible pains in my abdomen for so long, to the point I wasn't leaving bed. A few days after the 3 AM pain I started pooping blood. It was small amounts, like if I were eating pizza or tomato that day, so I didn't actually realize it for a while until the blood was a lot. Coincidentally, I had a doctor's appointment the next day and told the backup doctor. She did the stick her finger up my butt and test for blood. I was indeed heavily bleeding and was sent to the ER. I'm crying and my doctor at the ER, bless him because he was so sweet, does the same test and I'm perfectly fine. A doctor has zero clue why I am sent because a bunch of tests deem me I'm perfectly fine otherwise. They mark it up as tomato as well. Tomato doesn't digest break down in your body, much like corn. My regular doctor comes back and I tell her, explaining that I'm still pooping blood and my abdomen still hurts. She sends me to some kind of doctor, can't remember the name. I'm very tired, and they set up a colonoscopy. Before said colonoscopy, the doctor doing this procedure comes over to the terrified 18 I am and starts asking questions because he's confused of why I am here. My answer's story of everything only confusing him more. Turns out the medication I was given basically exploded my stomach, causing internal hemorrhoids to form and also break inside, which caused the bleeding and horrible pain. Took 4 months and 5-ish different doctors to figure out what happened to me. I work as an ophthalmic assistant for a private ophthalmology practice that also employs an optometrist. I was doing workups for the optometrist when I offhandedly asked him what the worst injury he'd ever seen was. He said that he once saw a patient that had been directly hit in the eye by a paintball. The hard outside shell had of course shattered and bits of shrapnel had actually pierced the guy's eye and injured his optic nerve and retina. And when the optometrist went in to try and look at the inside of the eye to assess the damage, there was so much blood in the aqueous and vitreous humor, the view was obstructed. The guy was blinded by a paintball because he didn't want to wear eye protection. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.